Michelle's not unlike many of my patients who are really not very overweight, works out, exercises, diets, and has some stubborn areas. She really was a very good candidate for liposuction.
Being in TV, being in the media industry, image is everything. Little things here and there I want to shape and fix as a woman, so that's what I'm here for. It's not a major surgery, but I just want to define myself and feel a little bit more confident. I had a friend that had used Dr. Amron in the past and said he was phenomenal. And I had met with a few other doctors that were just not the same as Dr. Amron. And it brought me back actually a year and a half later.
Hi Michelle, Dr. David Amron, nice to meet you. How are you? When I saw her, I evaluated her really from top to bottom. I feel it's a really mistake just to focus on one or two areas that the patient points out because you have the risk of really throwing them out of balance or proportion if you do that.
I really felt with Dr. Amron that he had my best interest at heart. That instead of my inner thighs, you need to do the whole thing as a unit. So that made me feel really comfortable that I was really in good hands.
I've done this for 16 years, I've seen thousands of people, and my eye quickly goes to what should be done with liposuction. The consultation is an important part of defining what should be done, and then the markings. The markings are a very important part of it. To me, that's a guide to what I'm going to do in surgery.
After the procedure, I want to feel very confident. I feel that it's very empowering to feel good on the inside as well as the outside. So, you know, there's these little areas that have bothered me for a while, and I'm just going to fine-tune them a little bit with Dr. Amron. I'm excited. Here we go.
Okay, we're going to be heading into surgery on Michelle. Come watch. So we're going to start putting the numbing fluid in just a second. The first thing I'm going to do though is numb the little access points. You're going to feel a little tiny poke. In the operating room, Michelle was very nervous, but really once the procedure started, as I noticed many times with patients, is that they become very calm with things. I try to create a very calming atmosphere in the operating room. The lights are actually purposely dimmed, and we're very good, myself and the staff, in terms of making the patient feel calm and relaxed, and that's exactly how it went with Michelle.
It's actually like so non-painful, and I'm very pleased.
The primary area was her upper outer thigh area, the saddlebag area, and then also I felt that she had fullness in her full inner thighs and knees, and that to create a proper balance and proportion and silhouette in her case, it's targeting both of those areas. Under local anesthesia, to me it's technically a huge advantage. Under general anesthesia, inevitably the surgeon's jabbing the muscle causing bleeding and bruising, but more importantly, it's how the skin is poked or jabbed or tented from underneath that can cause the irregularity. So I'm very particular how the patient is always positioned during the surgery so I can be at the right plane. Keep this leg locked, but twist the foot out. Good. To me, it's all about nailing it, getting exactly right in every patient the first time.
Hi, I'm back from surgery, and I cannot believe how nervous I was going into it. And here I am, feeling good, and I feel no pain, and I'm smiling, and I'm super excited to see the results. Hi!
How was it?
I am like close to crying because I'm so happy.
Michelle was a wonderful patient. She had some anxiety and fears before going through the procedure. She was definitely an outstanding candidate, and I'm going to give her a great improvement with liposuction. I'm actually going to give her an improvement that she'll never be able to get herself. Yes, it's important for her to continue to exercise and to keep her weight down, but she's not a very overweight girl. And so really, in a person like Michelle, the vast majority of her improvement comes from me in about the hour and a half that it took to do the surgery. And really, those are permanent improvements.
Honestly, I just think you're so talented. And I really feel like I picked the right doctor, and I'm very appreciative. Thank you. Thank you. This procedure is probably easier than going to the dentist. I'm very, very impressed, and I'm very surprised. Yay! Do I look good? Do I look like...
You look fine.
I know, can you believe it?
Yeah, well, let's get you home and get
Okay.
you comfortable and happy. And
Yay.
perfect.
She'll go home today in the care of her friend, take it easy today, lounge about the house. 2 days later, I want her actually doing whatever she feels comfortable doing. If she wants to go back to the gym and she feels comfortable doing that, then she should do that. I think it's actually going to tend to promote the healing and reduce the swelling.
I'm like smiling after surgery.
She was amazed at how easy the procedure really was and had a smiling face.
I feel really lucky to have found Dr. Amron and had this experience. I picked the right doctor. So I'm happy to see the results and I can't wait.